Sometimes you might hear about measles in the news. Measles is a sickness that can spread easily. Many people think only children get measles, but this is not true. People of all ages can get sick with measles. This includes older adults like people over 65 years old. This text will talk about measles and older people. It is important to understand if older adults have special risks from this sickness. Their bodies might react differently to measles than younger people's bodies. Knowing the risks helps older people stay healthy. In this text, we will look at several important topics about measles. First, we will learn some basic facts about the sickness. What is measles and how do you get it? Second, we will talk about measles in the past. Many older adults today were children before there was a good vaccine shot. Some may have had measles when they were young. Third, we will look at the risks for older people today. Why might some older adults need to be careful about measles? Fourth, we will learn about the problems measles can cause. Measles is not always a simple sickness. It can sometimes lead to other health issues like problems with breathing. These can be more serious for older adults. Fifth, we will talk about the vaccine, the shot that helps protect people from getting measles. Sixth, we will discuss how older adults can stay safe. This includes talking to a doctor and knowing if you are protected. Understanding these points is helpful for older adults and the people who care for them. 2. What is measles? Measles is a sickness. It is caused by a very small germ called a virus. This virus makes people feel quite ill. Measles spreads very easily between people. It moves through the air. When a person with measles coughs or sneezes, tiny drops fly into the air. These drops have the measles virus in them. If other people breathe in this air, they can catch the virus and get sick. You can also get measles if you touch something that a sick person has touched, like a door handle, and then touch your face, nose, or mouth. Because it spreads so easily, many people can get sick quickly if someone has measles. How do you know if someone has measles? There are clear signs. Usually, the first signs are like a bad cold. A person might have a high temperature, sometimes over 40 degrees Celsius. They will likely have a cough and a runny nose. Another early sign is red eyes that might be watery. Sometimes, small white spots can appear inside the mouth for a short time. After about 3 or 4 days of feeling unwell, a skin rash appears. This rash is a key sign of measles. It often starts on the person's face or behind their ears. From there, it spreads down over the whole body. The rash looks like small, flat red spots. These spots might join together to make bigger red patches. The rash is usually not itchy. The whole sickness often lasts about 7 to 10 days. Measles is often thought of as a childhood sickness. Many children used to get it, but it is important to know that adults can get measles too. Older adults are not safe from it if they are not protected. Knowing these signs is very important. If you think you or someone else might have measles, it helps to know what to look for. Recognizing measles early can help stop it spreading to family, friends, and others in the community. 3. Measles in the past. Many years ago, measles was everywhere. Before doctors had a vaccine, a special shot to prevent the sickness, almost every child got measles. It was a very common illness, much more common than it is today. Most families expected their children to get sick with measles at some point. People knew it spread very easily from person to person. Think about older adults you know, like your grandparents. Many people born before the year 1960 probably had measles when they were young. It was just a normal thing that happened during childhood for millions of people around the world. When someone got sick with measles back then, their body had to fight the measles virus all by itself. After the person got better, something important happened inside their body. Their body remembered the measles virus. This memory is like a special defense plan. If the same virus tried to enter their body again later in life, their body knew exactly how to fight it off very quickly. This defense is strong and usually lasts for their entire life. We call this natural immunity or natural protection. Because they had the sickness once, they usually could not get it again. So many older adults today have this natural protection because they were sick with measles as children. Their bodies are usually safe from measles. However, it is important to remember that not every single person got measles in the past. Some people were lucky and never caught the virus. Also, the first measles vaccine became available many decades ago. Some older people might have had the vaccine, but maybe they only received one shot instead of two. Sometimes the vaccines used long ago were not the same as the ones used now. And often, older people cannot remember for sure if they had the illness or the shot. They might not have any medical papers from that time. This history helps us understand the situation today. While many older people are protected naturally, some might not be. Knowing about measles in the past helps explain why it is still important to think about measles risks for older adults now. 4. Why older people need care. As people get older, their bodies change. Sometimes the body's defense system, called the immune system, works less well. This means their protection against sickness can become weaker over time. This can also happen with protection against measles. Some older adults had measles when they were children, or they had the vaccine shot many years ago. But after a long time, their protection might not be as strong as it was. Their body might forget how to fight the measles virus effectively. This means they could get measles more easily, or the illness might affect them more seriously. Also, remember that the measles vaccine was not always available. Many older people were born before the vaccine was common. Some of these individuals had measles as children and likely have good protection. However, some older adults might never have had measles and also never received the vaccine. These people do not have protection against the virus. Without protection, their body does not know how to stop the virus quickly if they are exposed to it. This puts them at risk of getting sick. Another important reason older people need care is that many have other health problems as they age. They might live with conditions like heart disease or high blood pressure. Some may have lung problems such as asthma or chronic bronchitis, which make breathing difficult. Other conditions like diabetes are also more common in older adults. These health issues mean their bodies might already be weaker or working harder to stay healthy day to day. Having these other health problems can make measles much more serious for an older person. Measles is not just a rash and fever, it can cause complications. If an older person with a lung condition gets measles, it can lead to severe breathing problems. If someone has a heart condition, measles can put dangerous stress on their heart. The measles infection adds more difficulty for a body that is already dealing with another health issue. Because of this, older adults with existing health conditions might get much sicker from measles than younger, healthier people. They may need to go to the hospital for treatment. This combination of potentially weaker protection and other health problems means older people need special attention regarding the risks of measles. 5. Measles can cause problems. Measles is often thought of as just spots and a high temperature, but it can be more serious than that. Sometimes measles leads to other health problems. These extra problems are called complications. While anyone can get complications from measles, they can be especially difficult for older adults. It is very important to understand what these problems can be. A common complication from measles is pneumonia. Pneumonia is a bad infection deep inside the lungs. When someone has pneumonia, their lungs can fill with fluid. This makes it very hard to breathe properly and get enough oxygen. For older people, pneumonia can be very dangerous and make them extremely weak. They often need to go to the hospital for treatment. This treatment might include help with breathing and strong medicine to fight the infection. Pneumonia is a major reason why measles can sometimes be a very severe illness. Another possible problem, though much less common, is encephalitis. Encephalitis is swelling of the brain. It is rare, maybe happening in about 1 out of every 1,000 measles cases. However, even though it is rare, encephalitis is extremely serious. Swelling in the brain can cause fits, hearing loss, or permanent brain damage. It affects how a person thinks, feels, and moves. Anyone with encephalitis needs immediate medical care in a hospital. It shows that measles is not just a simple childhood sickness. Measles can also create difficulties for older adults who already have health conditions. If someone has long-term problems like asthma, chronic lung disease, or heart disease, getting measles can make these conditions much worse. For instance, measles infection can trigger severe asthma attacks. It can put a dangerous amount of extra strain on a weak heart. The body is already fighting measles, so it has less strength to manage existing health issues. Because of these risks, older adults, especially those with other health problems, often need hospital care if they get measles. Doctors in the hospital can monitor them closely. They can provide support for breathing, treat infections like pneumonia, and manage the worsening of other conditions. Getting medical help quickly is key. Understanding that measles can cause these serious problems helps people see why preventing the illness is so important. 6. Stopping measles with a shot. A special shot can stop people from getting sick with measles. This shot is called a vaccine. Think of the vaccine as a teacher for your body's defense system. It safely shows your body what the measles virus looks like. This teaches your body how to recognize and fight the real measles virus if you ever meet it. Because your body is prepared, you are much less likely to get sick. If you do get sick after the vaccine, it is usually a much milder illness. Many children around the world get a vaccine for measles. It is often given together with vaccines for 2 other sicknesses, mumps and rubella. This combined shot is called the MMR vaccine. This vaccine is very safe and works very well. Using the measles vaccine started a long time ago, many years back. Because so many people got the vaccine, measles became much less common in many countries than it was before. However, the vaccine program and the vaccines themselves have changed over the years. When the vaccine first became available many decades ago, people might have received only 1 shot. Today, doctors usually recommend 2 shots because this gives stronger and longer-lasting protection. Also, the type of vaccine used in the very early years was different from the improved ones used today. This history means some older adults might not be fully protected against measles today. Perhaps they only got 1 shot when they were younger. Maybe the shot they received was an older type that does not offer the same strong protection as the modern vaccine. Some older people might not have received any measles shot at all, especially if they were born before 1957, when the virus was very common and before vaccines were widely used. Understanding how vaccines work is very important for preventing measles. Knowing about the vaccine helps people make good choices for their health. Knowing if you had the vaccine shots, how many you had, and maybe which type, can help you understand your own protection level. This knowledge is a key part of staying safe from measles, especially when the sickness is spreading. A protection from the vaccine is the most effective way we have to stop measles. 7. How to be safe from measles. Knowing if you are safe from measles is very important, especially for older adults. Some older people might have a higher risk if they get sick. So how can you find out if your body is protected? The first step is to talk with your doctor. Your doctor knows about your health history. They can help you think about your past. Did you have measles as a child? Many older adults did. If you had measles illness before, your body usually remembers how to fight it. This means you likely have natural protection called immunity. Also, ask about vaccine shots. Did you get a measles shot years ago? Your doctor might have information about your vaccines. Sharing what you remember is helpful too. Sometimes it is hard to know for sure. Maybe you cannot remember if you had measles. Maybe there are no records of your shots. In this case, your doctor might suggest a blood test. This test looks for measles fighters called antibodies in your blood. If the test finds enough antibodies, it means you are protected. This test can give you peace of mind. What if you are not protected or you are still unsure? Your doctor might recommend a measles vaccine shot. This is usually the MMR vaccine. It protects against measles, mumps, and rubella. Some older adults might need this shot. For example, if you were born after 1956 and are not sure about your protection, or if you plan to travel, your doctor might suggest it. Getting the vaccine is the best way to protect yourself if you do not already have immunity. Your doctor will help you decide if the shot is a good idea for you. Besides vaccines, good habits help stop germs. Washing your hands often is a simple but strong way to stay healthy. Use soap and water and wash for at least 20 seconds. Do this many times during the day. Keeping your hands clean helps prevent measles and other sicknesses from spreading. Taking these steps helps you stay safe from measles. 8. What can you do? Measles can be a serious sickness for some older adults. It is good to remember this because it can cause other health problems, especially if you already have issues like weak lungs or a weak heart. Knowing if your body is protected from the measles virus is very important. Maybe you had measles when you were young. Maybe you had 1 or 2 vaccine shots. It is good to be sure. The best action you can take is to talk to your doctor or nurse. They understand your health history. Ask them about your personal risk for getting measles. Ask them what you should do to stay safe from the virus. They can give you clear advice based on your situation. Your doctor might suggest a blood test to check your protection. Or they might say you need a vaccine shot, maybe just one more. Trust their advice. It is also very important to know what to do if you start feeling sick. If you have a high temperature, a cough, and maybe a rash, you might have measles. If you think this, do not go straight to the doctor's office or the hospital. Please call them first. Explain your symptoms on the phone. They will tell you what to do next. Calling first helps stop the sickness from spreading to other patients and staff. Protecting yourself from measles is not just for you. When you stay safe, you also help protect other people in your community. This includes babies too young for the vaccine or people with weak immune systems who can get very sick. Your safety helps keep everyone safer. Finally, try to stay informed about health news. Sometimes, health officials give new advice about sicknesses like measles. Knowing the latest information helps you make the best choices for your own health and the health of people around you. Taking these steps is how you can help fight measles.